And now I want to take that overview, want to put it within the knowledge mobilization framework. And within this framework, I want to actually look at 7 critical trends or aspects of knowledge mobilization. And then I'm going to tell you stories around that. If we look at knowledge mobilization, and that is to take knowledge, both external and internal, and it is to move that knowledge out with the result of social action, that's what we're doing. But a really critical piece for knowledge mobilization to work is convergence. There needs to be the convergence between what the organization's doing, what their aim is, what the outside research, external research is discovering, and what external messaging is happening, and also what is happening within communities. So I want to give you 2 examples of convergence that really work very well for us. And one of them is this. So for those of you who have worked in this area, understand violence, you know that in 2002, the World Health Organization came out with a typology of violence. This typology of violence became a really very important building block for us, because it was now no longer what we were discovering from our program delivery and what communities and individuals were telling us. It was now there was a big organization out there that was saying this is a public health issue and there's a typology to go forward. The other thing that is really important when you look at this typology and why it be specifically important for the Canadian Red Cross is in the Red Cross movement, you see that there are 2 main branches. One is the ICRC, which is the International Committee of the Red Cross, and they deal with all conflict. They hold the international humanitarian law. They are the conflict specialists. And then there is the Federation, which is a federation of 187 national societies, and they hold all the other work that is done. So within our organization, and you can see when we talk about influence, that we need to be really clear that we make the difference between what was conflict or collective violence and what was interpersonal and what was self-directed violence. So this typology, this convergence of these thinking and idea, made a very big difference for us. And then the other piece that made the big difference built on that was this information that came out from the WHO. That if we look at those 3 areas of violence, we see that really 89% of violence is around interpersonal and self-directed. And as a world and as a big organization, we'd put the majority of our resources into collective violence, into conflict. And so this helped us define a really big gap. And it really helped us do greater buy-in internally, which then went externally. So the convergence of what we were discovering within the communities and the message that came from the WHO became a really critical building block for us and moving knowledge out. As a result of that, and that whole being able to do that, we then started developing a program called 10 Steps to Creating Safe Environments. And it's really not a program. I need to back up on that one. It's a process. It's a process of taking communities, taking organizations, taking their information, their experience, their reality, and then helping them move through that with the right questions and with the right group processes to actually come up with a risk assessment, to come up with a risk management plan, and to come up with an action plan, which then allows them to be able to create safe environments for their kids, for their youth, and for the people in their organization and community. This program, this process, we have now done within 28 other countries. we will just have this fall, we'll have the lessons learned from what we have learned from this process within 8 countries in the Americas. So this is going to be a really critical one.